Welcome, everyone. I'm Dan Gillison, the CEO of NAMI, where we wake up every day to help millions of Americans affected by mental illness build better lives. This year, in the wake of COVID-19 and numerous national tragedies, that mission feels more urgent than ever. We are incredibly fortunate to have the support of many corporate partners who have made mental health a priority in their organizations, supporting their employees, spreading awareness, and helping decrease stigma around mental illness. Our Roundtable executives who are with us today exemplify true leadership in corporate action, and we are deeply grateful for their vision and support. They look forward to sharing their experiences with you. I'd like to turn you over to our conversation host, Elyse Cohen, Vice President of Social Impact and Inclusion at Rare Beauty, a NAMI stigma-free company, partner, and a cosmetic brand founded by Selena Gomez, where they work to support the mental health of its community, employees, and partners. A strategic leader and advisor, Elyse was Deputy Director of First Lady Michelle Obama's Let's Move initiative to help raise a healthier generation of kids and families. A people person who generates change, Elyse is a connector and relationship builder. We are pleased to have her join us for this conversation. Elyse?
Thank you, Dan, for that kind introduction. It is not lost on me that this time a year ago, you were in conversation with our founder at Rare Beauty, Selena Gomez. So here we are a year later after our brand has launched, and we've spent the last year partnering with your organization and really honing in on addressing mental health. I'm excited and honored today to be facilitating this conversation with many of the brands that we work with. And I'll serve as a facilitator, as well as have the opportunity to chime in here and there. In any conversation about mental health, we need to remember that 1 in 3 Americans are struggling and may need support. NAMI is that support system that ensures that you are not alone. Whatever is going on in your life, know that it is okay to not be okay. NAMI has been working with an incredible number of corporate partners for the last decade. During that time, NAMI has seen the corporate sector embrace mental health and become champions for the cause. They are leading the charge by developing powerful campaigns, enacting groundbreaking employee policies, and providing financial support that enables NAMI to support millions of Americans and their families each year. I am delighted to be joined by many of these visionaries today. I want to first introduce Kendra Scott, philanthropist, mom, designer, and executive chairwoman of Kendra Scott LLC, a leading fashion accessories brand, whose accessories I just so happen to be sporting. As the brand continues to grow, it remains true in its founding philosophy of family, fashion, and philanthropy, donating over $30 million to local, national, and international causes. Kendra believes in the uplifting power of beauty and works to deliver that feeling to individuals everywhere. As part of her commitment, Kendra Scott has been a champion for mental health, partnering with NAMI and Active Minds to support young people in getting the help they need. Please join me in welcoming Kendra.
Thank you so much. I'm so thrilled to be here today.
Now let's meet Kenneth Cole, the founder, executive chairman, and CCO of Kenneth Cole Productions, an American fashion brand founded in 1982. For more than 30 years, Kenneth and the global brand have sought to make a meaningful connection with people by addressing not just what they look like on the outside, but who they are on the inside. Not just what they stand in, but what they stand for. Kenneth Cole has championed countless advocacy campaigns around mental health and recently founded the Mental Health Coalition, a collection of advocacy groups, celebrities, and business leaders whose goal is to remove stigma around mental health and help people access the services they need. Kenneth Cole believes business and philanthropy are interdependent. Please join me in welcoming Kenneth Cole.
Thank you, Elyse. It's very sweet. Very kind of you. Thank you.
And the third member of our illustrious group is Alexandra Von Plato, CEO of Publicis Health's worldwide network of 11 agency brands. Alex leads her teams of creative and strategic professionals with varying expertise, all focused on connecting healthcare and wellness brands with the people who need them. A skilled marketer, business leader, and award-winning creative director, Alex has overseen the development of groundbreaking marketing initiatives and programs for leading life sciences, biotech, consumer, and wellness companies. Her expertise in healthcare, creative innovation, and marketing have made her a sought-after contributor at industry-leading events. She's in the forefront of understanding and shaping the role of digital media and new technologies in healthcare communications. In addition, Publicis Health was recently recognized by NAMI Chicago as an outstanding workplace leader in mental health. Please join me in welcoming Alex.
Great to be here. Thank you.
Wonderful. Okay, so we're going to get started, and I've got a couple questions for everyone, but truly want to encourage everyone to engage in dialogue and conversation. So Kendra, I'll start with you. With so much in the world for brands to focus on and advocate for, I'd love for you, and after you chime in, I'd love to hear from everyone else, a bit about how you decided to make mental health a priority for your business, and why now?
You know, I think now is the time, right? We've all gone through such to say a scary and unpredictable year would be the understatement, right? The great understatement. And working with so many women and mothers in my company, we have over 95% women at Kendra Scott, and seeing the struggles that my own employees were facing during the pandemic of trying to play the role of teacher and mom and chef and, tech support and all of the things. And it was just so much. And also feeling isolated. I have 3 sons, college, high school, and a little one in elementary school, and seeing them struggle also of just being away from their friends, trying to figure out how to socially navigate this time. I felt like now was such an important time for all of us to really speak out about how important it is to take care of our mental health, and to know that there are resources out there to help everyone, no matter what your age or stage in life is. And it really became such a big priority to me because I was also suffering. I went through a divorce in 2020, in the midst of this pandemic, owning stores, over 120 retail stores that I had to figure out how to close and take care of my employees. And I think it was really important for me to also look in the eye of my employees and say, it's okay, like you said, to not be okay. And the strongest thing we can do is to ask for help. That is the greatest sign of strength. And to really, not just say these words, but then let's make this an active conversation within our own 4 walls, but also with our customers who are part of our family too, and really trying to make a bigger presence in this movement. And we've been really blessed that I think a lot of people have wanted to have these open and vulnerable conversations, and are feeling good to be able to know that we're all in this together. You're not alone. And I think that was the biggest thing for us as a brand to be able to say.
Yeah, thank you. And I think it's been interesting, so many of us and your brands have been focused on mental health for years. The statistics have always been staggering. It's always been an issue. But the pandemic, if we almost have to find a silver lining, it feels like the pandemic catapulted this conversation to headlines in ways that we wished would have happened years ago, giving people an opening and an opportunity to come together and talk about it more and bring more voices to the table. So Kenneth, I'd love to hear a little bit from you on what made you start the Mental Health Coalition. It wasn't started during the pandemic; it was started before. What was sort of the impetus for you addressing mental health?
So I had spent many years working in HIV, and the company has always, I personally and the brand and the company have always committed ourselves to certain advocacy-related issues, and I found myself speaking about HIV 35 or so years ago, and I got very involved, and then I stepped away a couple of years ago, and I came to realize HIV was affecting 1 in 200 people, but mental health related issues actually were supposedly affecting 1 in 4. And then we came to realize that it was probably 4 in 4, because if it isn't you, it's somebody you love, somebody in the family, in the community, in the workplace, but we're all living with it. And and it's overwhelming all of us. And the humanitarian case for it is very clear, and the business case for it, interestingly, is even more clear to the degree people understand it and aware of it. And so it's impacting us in ways none of us could have imagined. So so my daughters, actually, something was also very important to them too, and then we had met, I think, with Katrina, and then Daniel at NAMI, and they kind of introduced us to the notion of the stigma-free workplace, and with that, all these other things that we could do to facilitate and to accommodate our workforce, who were all struggling with it, as as we came to realize, we all are in different ways, and not only is it just the right thing to do, we came to realize it's also it's just the right business thing to do, which is a case that isn't often made publicly. It's for retention, for recruitment, and for productivity. The numbers are staggering. It's the largest reason for absenteeism in the workplace. I think 200 million lost workdays every year. Cost to employers of 17 to 44 billion dollars. So it's a great allocation of emotionally and also financially of resources. And we put together the coalition, initially working, I think, with NAMI, and then came to realize if to really make an impact on stigma, it's going to require that that we essentially change the narrative, because everything it's clinical, it's stigmatized, and to give people a platform from which that they could find their own voice and they can express themselves, because I think it's also believed that 2/3 of those living with mental health conditions do so in the proverbial shadows, so absent of a platform. So we, NAMI kind of helped us get started, and then we systematically reached out to the next 30 largest mental health service providers, and they all systematically, categorically signed on. And so now we built this, I think today is probably the largest coalition of mental health service providers in the country, maybe everywhere. And with the goal of rebranding mental health service providers. And we started working with some large media companies like Facebook and Instagram, and we, as well as iHeart and several others. And we launched this month a very comprehensive lives every day in May, and we're doing with individuals who are very inspirational in and of themselves and trying to, in effect, change culture, because that's what we believe this is going to take.
I love that. Yeah, we talk a lot at Rare Beauty about the power of storytelling and how we truly feel that it's the stories and storytelling that is at the heart of changing culture around mental health. It's the only way that people start to feel they're not alone. Someone's story resonates with them. And it just takes just finding one person that you feel like you connect with. And the Mental Health Coalition and platforms like that enable people to do that storytelling in ways that they may not, they're not going to go take a stage perhaps, but it's an open space for them to do that. Alex, what about you? What prompted Publicis Health to really address mental health and certainly and be honored by NAMI as well as a leader?
Well, as a healthcare communications company, we have a very strong corporate social responsibility program. So we work in many areas of illness to encourage people to get engaged and to offer them different kinds of help, including, Kenneth, in HIV, where we were early on in the advent of antiretrovirals and introducing, treatment and therapy options, and asking people and creating situations where people could come and get tested for something that they were, obviously not comfortable with sharing or talking about at the time, and still it's an issue. So I've always been involved with corporate social responsibility, and particularly around stigmatized illnesses. And my coming to mental health and mental illness was a very personal story. In 2016, my sister committed suicide. after a very kind of brief bout, a 3-year bout with major depressive disorder. And she had 5 children, and it was just a catastrophe, as you can imagine, for my family and my extended family. And I began to, I was a person who had launched a lot of the armamentaria in mental illness for MDD, a lot of the treatments for bipolar disorder and schizophrenia. And I thought I knew a lot about how people suffer. And here in my very own family with my sister, who I was very close to, her depression became terminal. And that's when I unfortunately got the worst wake-up call of all. And I started to look into the statistics and the kind of precursors of suicide and what the signs were and what the epidemic was all about. And one of the things we recognized when I dove into that unfortunate end of the pool was that young people were suffering inordinately. And this was all before the pandemic. So every year we have an incoming intern class that we assign a corporate social responsibility project to. And in 2017, with NAMI's help, we launched a corporate social project for interns to develop a campaign that would destigmatize mental illness for kids on college campuses and young adults. And we learned so much from them about how to talk to them about this highly stigmatized issue that they were all confronting. And the last thing I'll say is when I shared my story with those young people and with my team from around the world, I can't tell you not just the outpouring of love and support, but the stories I got back of people who, my family member, myself, my mother, my best friend in college, the stories about people who had confronted, that aspect of mental illness where people are considering taking their own life. And it is an extraordinarily much more common than we could ever imagine occurrence. And that's why I've dedicated much of what we do in our own CSR initiatives to this subject matter, because I want to save anybody I can from having to go through what we went through.
Well, thank you. Thank you. First of all, we are sorry to hear about your sister. And, I think so many of us come to this space and this work from that experience. And when you think about the statistics, it makes sense. I too live in a family with a family member, and it's part of my own journey. And it's part of what brought me to this work as well, and felt the very same way, that it's not until you share and you talk and you learn that there are so many people experiencing the same thing. And I think, we were waiting for that moment, and I hope that moment is now. And in every role that everybody plays, we can channel that in our own way for change. So thank you. NAMI's partners are often surprised by the influx of comments and feedback from their employees and customers when they start speaking about mental health. What type of feedback have you all received on your journey? Has advocating for mental health in your brands made a positive impact for your business and customers and employees? What thoughts do you have on that? Kenneth, I'll start with you.
So, I think everybody is touched by it. Everybody relates to it. It's and it's not necessarily one of those things that people know how to articulate. But we have built it into the culture, of the company, and we offer a mental health service, a mental health day to associates. We basically have tried to, in effect, understand, normalize the discussion and make it comfortable for people to talk about it. We have a process also called Care 24 Services, where all associates 24/7 can access a wide range of health and well-being information support. So, it is what it is. People struggle with it. We'll struggle with, with certain things, basically uh, on a frequency that's individual, and you just try to be supportive of it. So, these are very difficult times, and I don't know where this takes us in this, what we call this PC post-COVID world, and how we process it, and what it all, and how we all deal with it, because it's not just each of us individually, it's our families and our people that we love. And after SARS, they had done some research, and a third of those people came through extensive quarantining with symptoms of PTSD, and another third symptoms of anxiety and depression that were lasting. So you layer that on top of the already prevalent and pervasive realities of mental health issues, and it's overwhelming to anticipate, to think about what this is going to do to all of us individually and as well as collectively.
Yeah, many have said that mental health is the second pandemic that we'll be facing.
Yeah.
Kendra, what about you at your brand? How has it impacted employees, customers? I know even recently you all announced another collaboration with Active Minds.
Yes, I think, look, when I started this business, I was a new mom. Very early on in my business, I then became a single mom trying to run my business. And it was one of those things where we felt like we had to be super women, like we could do it all. We had to be able to have this great career and be able to get dinner on the table. And, everyone would ask us the question, how do you balance it all, Kendra? And I started realizing that the answer was, I don't. I am very terrible at it. And some days are great. And some days I cry myself to sleep thinking I failed my family, or I haven't been there enough in my business, and started being vulnerable and honest, and not trying to act like a superwoman, just acting like a woman, a human that struggles like everybody else. And when I realized, when I started to do that, my employees felt safe to be able to do that. Our customers felt safe. And we started really having really amazing dialogue. And I believe that, look, I need to start to listen to them more. I need to ask, are you guys okay? What things are you struggling with right now? So in our business, I've been 20 years now. There was a lot of us, we're very young in our 20s, and everybody got married. And we went kind of through this phase. And then after marriage, everybody's having babies now at Kendra Scott. And so we started forming different groups. We formed new moms and new dads group to talk for new parents, what they were going through and the struggles they were having and the sleepless nights, and what we could do as an organization to help them during this time. We had lots of nursing moms. So we started creating nursing rooms within our corporate headquarters with mother's milk refrigerators and warm cashmere blankets that they could pump or they could bring their baby in. And then some of those became toddlers and little kids. And we started realizing moms need to be able to sometimes pick them up from work. So we created a kids center where the kids could come and play after school or in the summertime after camp. And also me setting the example of, I want you all to be there for your families first. Family is first at Kendra Scott. I will be upset if you miss something versus the opposite. I want you to get out of here and get to the soccer field. I want you to stay home with your kids when they're sick, because I believe and respect and trust you. And if you're happy and healthy and your family is happy and healthy, you're going to be a happier, healthy employee, right? For our business. And exactly what Kenneth had mentioned, this creates unbelievable retention, because when you have happy people, they're more productive. When you have happy people, they don't want to leave an organization. You become such an engrossed family. Unlike a lot of companies where people are afraid to tell their boss that they may be pregnant because, oh my God, I'm going to have to go on maternity leave, and we're the opposite at Kendra Scott. Sometimes I'm the first person they come and tell, because I'm so thrilled and excited for them. I'm a mom and I can have a career, but I also am here to be like, how can we support? And you've got an army of support around you. And please ask us for help. And so during Mother's Day, And I'm thinking about this because here I am, mom of all these boys, and seeing and hearing what our own moms were going through and going, moms are struggling right now. I know we're celebrating Mother's Day, but if there was ever a Mother's Day that we need to really celebrate moms, it's this Mother's Day. And in addition to that, we need to have a conversation and say, are you guys out there? Do you know a mom who is struggling right now? Do you know a mom that might need a break, a mental health break, a break that, you know, she desperately needs but may not be able to do? So we formed a paid time off grant, $100,000 grant, and we designated 50 moms. We had thousands and thousands of submissions, but what happened in those submissions is conversations were happening between the people saying, this is what I'm going through, this is how I'm struggling. And then all of a sudden they were getting strangers replying to them, wow, so-and-so, I'm thinking of you, you know, I'm going through a similar thing. And we created this open dialogue of acceptance of saying, hey, we're all struggling, and we were able to share some of their stories and hear these moms. And I think that's the key right now, is through social media, through the ability to connect like we're connecting right now on a screen together, we're still able to connect and being able to be vulnerable and know that the struggles and the things in our life that are hard, that's what makes us unique. That's what makes us special. And we all go through it. No one is perfect and shiny and pretty like we look like on Instagram with our dog, you know, and our kids smiling. That probably the pictures before that everyone's a hot mess, right? So having more of those open, real conversations is good. And to stop feeling like we have to be everything all the time. That is not a realistic goal, right? We just have to do the best we can every day and know how to listen to other people and say, I'm here for you. Here's some resources for you if you are struggling, because there's so many like NAMI, Active Minds, brilliant organizations available to provide help. And that's such an important conversation to have. And I think the more that people of, you know, like Selena and so many others who are standing up and saying, this is who I am, and I'm not this perfect thing that you think I am, but I'm my imperfections make me perfect. And that's what makes us all perfect. So, you know, I'm just excited that as an organization, we've done this from day one. But now we can really start to do it broader and bringing our customers into these conversations and making them feel safe, that they're in a safe place. They can talk about this, and it doesn't matter what they're going to say. They're going to be loved and supported.
I love that. I love you almost snagged our tagline there, which is great. We've had a similar experience at Rare Beauty. Actually, our customers and audience are primarily in the Gen Z community, and on social, we share a lot of educational resources. It's one of the largest sort of platforms of information that we share, and so we'll do sort of like a bipolar 101, anxiety 101. We have experts, and the questions from our community and sort of that chiming in of, oh my gosh, me too, or I was having such a bad day and you made this day better for me. It's creating community in ways that we never maybe thought that we could. And it's been really interesting. It sounds like from both you and Kenneth, it's a lot of leaning in, listening, and showing up vulnerably and showing up really as your whole self from the top down, so that teams can truly see everybody talking and everybody feeling comfortable and connected in that way. Alex, what about you? Anything to add?
You know, it sounds like, you know, Kendra, you're making such an effort to make your workplace a healing place. And we often hear about how work is toxic, and, you know, your toxic office and the toxic relationships and the toxic boss. And work can make people sick. And by the way, I didn't make that up. That was Alexa Jones, from the CEO of NAMI in Chicago, said that to me in a conversation we were having. That we often hear how work is toxic and can make people sick, but it also can help people feel better. And it can be a healing experience. It can be rewarding and uplifting and affirming. And especially if we give people the chance to share, and you demonstrate that. You know, we demonstrate that we're to be made vulnerable and we can share, so that allows other people to do the same, and we create safe spaces for them to do it. So So I think we are part in our work environment. We're part of creating a healing revolution around mental health. And, we not, and we get the benefit of that because people can be more productive when they bring their whole self to work and they feel accepted and they feel like they belong, even though they might be struggling with something. And I think it's a really active place for us, difference with our own teams and our own folks. So I couldn't agree with you more, Kendra, and I really admire some of the programs that sounds like you guys are doing with great earnesty.
And that's actually a great segue into something else I wanted to ask. Do you all have a favorite project, collaboration, product, something that you've done recently to address mental health, or just something that feels outside the box that you're most proud of?
I think that Mother's Day program for me was something I once we did it, I said we had so many submissions. I'm like, we need to do this again. We need to do it more because I was able to meet with so many of these mothers and have conversation with them. And it was just so touching to me because I just felt like it was such a diverse group of women across the country, but so many of us had so many similar stories that we were feeling or things that we were experiencing. So I think that one was really special for me. And I also just feel like having our employees be able to connect in different groups, whatever that might look like. We had a group that was also a group that were going through IVF and the struggles of IVF. And we started realizing we had a lot of employees. Well, let's get them together. Because we could maybe help them and we could bring those people together. And then they had this support group and they had a little army around them of coworkers. And some of them had no idea that, a girl that's in finance or one of our store managers in Tennessee or whoever it might be. And I just felt like, wow, connection is what we've really realized. And we say at Kendra Scott all the time, even with our stores, is for our customers, when you come in, I don't care about transaction. I care about connection. I want you to make a connection with our customer. I want them to leave with a smile, even if they don't leave with a little yellow bag in their hand. If they leave with a smile, they feel good, they feel welcome, they feel loved. It's a place of community. You have done your job, and they will come back as a customer. That transaction will happen, but the connection comes first. And, we really just promote that in all of the conversations that we have, and you get to see that in our stores. We have customers coming in after their cancer treatments to come into our store because of the fellowship, the friendship, the community that they've established with, our sales associates who are right there to give them a warm hug pre-pandemic, when they came in, and, to get them a piece of jewelry to make them feel better after this very scary time in their life. We're in pediatric hospitals, 31 hospitals across the country with our Kendra Cares program, where we bring the color bar to life for pediatric patients. But what we found is the mothers sitting by their children's bedside day in and day out, how their mental health has been affected. So how can we also help them find the resources they need to guide them during this time? And so certain things that we've done in the program of let's just bring joy and happiness into the hospital, we realized, wow, we have an ability now to even create more change for the positive, and let's start talking about mental health in the programs that we're already doing. So those are just a few, but the conversations are just beginning. And like you said, I feel very hopeful that we are starting to help get the stigma away from having these open, honest conversations so that we can all be more vulnerable and know that that's okay.
I love that. It's interesting. You mentioned the intersection of mental health and all these other programs and issues that you may work on. And that's something that I think, folks have really seen in this past year. Mental health is not just a separate issue. It really truly intersects with everything else that's going on, whether it's physical health, whether it's social and racial unrest, every single thing impacts and intersects with mental health. Kenneth, Alex, projects, anything you want to add?
First of all, I'm going to go find myself a yellow bag after this program. But
Well, Kenneth, first of all, I'm like the biggest. Can I just tell you though, first, when I heard that Kenneth Cole was coming on, like since I was a kid, I've been like obsessed with your brand. So I was like, the Kenneth Cole? Like I had to get kind of zhuzhed for you today. So just so you know, I mean, you're like a hero to me.
you're beyond kind, and congratulations on what you've built and how you run your business, and I'm inspired by that, and it's good to know that it's okay to be a soccer mom and work at Kendra Scott. So, but that all aside, one other thing that we also do, and I think to Kendra's point, is we set up on the heels of the DE&I conversation that was happening. We set up these affinity groups where people actually can have a voice and they could be heard by different sectional members of the organization, and they can talk about their personal struggles, and that's been embraced by pretty much systematically by everybody. So I think in that same light, that has been very helpful. But people need to have a voice, and as important as it is to be able to be vulnerable, which is hard, especially for non-women, it's harder than otherwise. And Black men specifically, Asian men typically have a harder time being vulnerable, but sometimes even harder than that is being empathetic, which is what enables people to be comfortable being who they are, and that's something that we are trying to deal with through all these one-to-ones on the at the coalition, to give people the tools to show up for others, which is hard to do and something that I'm personally working at. I do it better than I used to, but not as well as I hope to. And but it's a journey. This isn't. I mean, we're not there, but we're better than we were, and not as good as we'll be. So, thank you.
Yeah, we also have been hosting. We've also been hosting what we call brave spaces, that are really about giving people the opportunity to share and support each other, without a tops down, just making the room for it in your organization. And then I would share a project that we worked on for a client that I thought was an amazing. We don't have a picture of mental illness. We don't even understand the brain. Like, we know what heart disease kind of looks like. Like, you can have a mental model for some things, but we had a client who created a campaign called Breaking Depression, and we used the Japanese art form. It's called kintsugi, and it's an art form where they break a beautiful piece of pottery, or they find something broken, and then they mend it in this gorgeous artistic way, often with gold, often with something precious. And the idea is to embrace the history of the object, and the breaking. The breaking was part of remaking it more beautifully. And like, that was such a beautiful metaphor, for mental health, and this idea that you can live, you can get through it. You might not ever be perfectly better and adjusted and whatever your version of mental wellness is, but the idea that this is something that you have, that you can be your authentic whole self, even if you have a mental illness, and it's not, that's part of destigmatizing it, I think, is being able to visualize it and talk about it in more than one way, and to see it through different lenses. And it's what I love most of creative communications, is that it gives us the chance to take things that are really hard to talk about and really hard to understand. Even if you have a medical degree, it's hard to understand. But give people a way to understand it. And I just thought this art form just really created a beautiful metaphor, and it's won many, many creative awards, and a lot of people who see the work, who themselves have struggled, say, oh, this has made me, there's something about me that I shouldn't run from or feel ashamed of. It's part of who I am.
I love that. I love that. And I do think we have to continue to work out and figure out how do we take the complexity of mental health and break it down into ways that people can understand it, they can relate to it, and we can communicate in a better way. I want to be thoughtful about the time before turning it back over to Dan to close us out. So I want to end with one question that I know is an important one, given that we have three CEOs and founders on the call. So obviously there are many people that are opening up and feeling more comfortable talking about mental health, addressing them in their companies. There are also many that still feel like it's a hard conversation. I'd love for each of you to just share one piece of advice for a CEO who wants to step into the space and wants to begin the journey of being a brand that's either stigma-free or more open in conversation and really addressing mental health.
I'll jump in. Look, I think I always try as a leader, to try to lead by example and to make people feel safe and know that I'm here to help and support them. And that I want to, train our managers on how to listen and how to make sure that they are also asking their teams to say, how is everyone doing, really? Are you okay? If you're not, come to me. These are the tools and the things I want to be able, these are access to things that we have here in the company to help you. And we have ways that you can do this privately. If you're not comfortable telling me, there are other ways that you can hear, I just want you to have this and know that we are here for you. And I think that what we talked about earlier too is, I've joined in and jumped in on some of these groups within our company of, moms, that we have the moms group. And I've jumped into some of those meetings, and I'm so thankful because they're like, whoa, Kendra's coming into this meeting, and I can sit there just alongside them going, woo, I had a week this week with my 17-year-old or whatever it might be. And I'm going through this, and anyone else have a teenager right now? Because I don't know if, I'm doing this right, or, I'm feeling like helpless right now. And I really believe that the more we can get out of the ivory towers and really get into being connected, having real, open, honest conversations, and being accessible as human beings to our teams and our managers, to our people, that's going to make such a difference. And I think it's going to make a big difference as we continue to work towards having a workforce that really is, or a workplace that is really stigma-free.
Thank you for doing this, Elyse. And it was great to do this with you, Kendra and Alex. So, one thing that I continue to remind each other, that we're in the perception business is what I do. And those are basically what I feel is my qualifications to be involved in building this coalition and convening and aggregating all these very smart people with extraordinary resources and giving them the light and the access to ultimately perpetuate such, and with our bigger goal of marrying needs to resources, which is what we're trying to do with the coalition. But I do feel that at the end of the day, perception becomes reality, and that if in fact we if we accept things and we normalize things and we enable, what we enable becomes a reality. And I encourage it, I support it, and there's nothing you can't do. There's nothing that's insurmountable. There's nothing we can't accomplish if we all align ourselves together and focus in the singular direction. Thank you, Elyse.
Kenneth, we talk about, we're in the perception business, but Michelle Obama recently came to Publicis Group to talk to us. And one of the things she said was, you guys, I wanted to come to talk to you guys because you make culture, like communications and advertising, and what Kenneth has done, with his brand in the marketplace to raise awareness and to create engagement, very fraught, stigmatized issues. You create culture, and you create a culture. We can create a better culture. We can use the tools that we have to work on our own cultures first, but recognize too that, we have the opportunity to bring our values to light in many inventive and creative ways that engage people's hearts and minds. And to bring that ability to this subject matter is, I just find it, we all find it, I'm sure, so compelling. And certainly it seems like everybody's been doing this, circling this subject matter for a while, but it's never become more important than it is right now.
Yep, I can picture Mrs. Obama coming in and saying that. I'm glad you had that. I'm glad she did that. Well, I just want to say our immense gratitude on behalf of NAMI and myself for all of you for sharing your expertise, your creative thinking, and bold steps in joining us today. And I want to turn it back over to Dan to close us out.
Thank you, Elyse, and I want to thank our illustrious guest. And I do have some scripted notes. Before I go to those, though, I want to give my impressions as we wrap up. First of all, each of our CEOs, they lead huge brands and manage incredible portfolios. And for them to take the time to do this on today, it brings to mind something about caring. And, people don't care how much you know until they know how much you care. And for all of you to take time out of your busy days to do this, on behalf of NAMI and everyone affected by mental illness, I just want to thank you sincerely. And the other thing is that this tone, someone said this is a moment. At least you may have mentioned that. Let's turn this moment into a movement. And I think that that's what we're on the cusp of being able to do collectively. I do appreciate your authenticity. And I also want to say thank you to Rare Beauty Brand and Selena Gomez. And why I'm doing that is because leadership doesn't have to be old like me. Leadership is about leadership. And that's what we need. And setting the example, as Kendra talked about, and role modeling the behavior you expect. And Alex, as you talked about the Japanese art form, we are doing something at NAMI that I brought in that's really looking at continuous improvement and Kaizen. And looking at continuous improvement. What does that look like for all that are affected by mental illness? And NAMI has 5 values: fairness, compassion, empowerment, inclusion. And the last one is the most important one: hope. We believe in the possibility of recovery, wellness, and the potential in all of us. And we got to leave everybody with hope. And that's what will keep us all engaged. And for me, coming to this body of work from the private sector, I know what it's like when you're challenged every 90 days with the shareholders and what it looks like. And so thank you for what you do and taking your time. So let me close with these official comments for our audience. Thank you to everyone who tuned in to watch this conversation, and to our extraordinary roundtable leaders for everything you do to bring awareness to mental health and in decreasing stigma. A special thank you goes to our excellent host, Elyse. Thank you. Bringing top corporate leaders together provides a behind-the-scenes look at mental health and how we can enhance the message and strengthen our partnerships. Now more than ever is the time for our private sector to lean in, to save lives and discover solutions. Together, we can make a real difference in the lives of millions of Americans. If you or someone you know is struggling right now, NAMI is here to support you. You are not alone. You can contact the NAMI helpline to access confidential professional support. If you have questions about NAMI or would like to inquire about a partnership or collaboration, please visit the NAMI helpline at nami.org/help or web chat or call 800-950-6264 Monday through Friday, 10 to 8 p.m. We are here for you. And I just want to close again by thanking our illustrious guests. Your messages were so on point. We really do appreciate it.